Good morning and welcome, Destroyed Economy. Thank you, Donald Trump and everybody else. Screamer, coronavirus germs. This is your ticker guy coming at you on the 17th. Hey, it's St. Patty's Day. You going to do a St. Patty's celebration? If I can find one. I'm going to go spend some money. Do you know why I'm going to go spend some money? Because, number one, I can't change a goddamn thing about the course of this virus, and neither can you. Not really. I know. The CDC says otherwise. Everybody else says you're all full of shit. And I'm going to lay the numbers out for you today. I threatened to do this a couple days ago. Now I'm going to do it today. And I'm going to tell you why what we're doing is stupid. I mean, just stupid. All right. Now, I get it. Nobody. My God, we have all these people in white coats, and we have to avoid overloading the medical system, because if we overload the medical system, millions of people will die. Lots of people will die. Well, that's true. That's absolutely a true statement. The problem is lots of people are going to die anyway. And nobody has actually thought this thing through. Because as soon as you do, you realize that the biggest game in the world is confidence that the doctor will save you. And it's a lie. It's a lie more often than it's the truth, and it's sad, but I can't change facts, folks. I cannot make things not be what they are. I wish I could. And there are a handful of countries, not very many, but a handful, that have figured this out. The funny thing is the UK went all bananas the other day after they decided they were going to do the smart thing, which is basically, look, we recognize that we can't lock the country down long enough for it to matter. Therefore, what we're going to try to do here is hopefully the people who will survive this virus without serious morbidity. In other words, they're going to get fever maybe a little bit. They're going to get a little bit of a cough. They're going to get something that's kind of like a mild flu. We want them all to get it, because the only way that we can actually attenuate the transmission rate and stop people from dying is for the natural immunity to build fast enough that R0 gets suppressed. All right, so we're going to start with what you have to do to actually stop this virus from progressing through the economy and through people. All right, and this is you can play with the complicated math if you want, but you don't really need to, because you can get close enough without the complicated math. And close enough happens to be good enough in a situation like this, because your individual R0 is a highly variable thing. When we talk about R0, in other words, the basic exponent factor for a disease, what we are talking about is averages. All right, so and that's important. All right, we have supposedly this virus has an R0 of about 3. And yet we have people like that crazy cult in Korea where they had one woman come in there and infect 500 or 1,000 people. I mean, that's insane. Her personal R0, what she passed on was 500 or something like this, which is nuts. But the average is 3. All right, and only the average matters to society. Yours matters to you, to your friends, to your loved ones. But socially, as a society, only the average matters. And here's the reality. In order for you to not have sustained transmission of a bug, any bug, the R0 must be below 1.0. If you're running a nuclear plant, K, the reactivity, must be exactly 1.0. If it's less than 1.0, the nuclear fire goes out. And if it's more than 1.0, the nuclear fire is not a nuclear fire anymore. It's a bomb. And the reason for that is that the generation time, that is the a period of time that passes between successive exponential events, is so small in a nuclear reactor that you must design it so that the automatic corrective factors that either make K go up or down happen at the same speed as that generation time. Otherwise, you either can't keep the reaction going or it explodes. All right. With a virus or some other bug, it's not that fast. All right, so this bug has a generation time of somewhere between 5 and 6 days. And this is the data that we originally got and that I've been charting out since this thing started in Wuhan when it was first publicly reported. And I have pointed out that we keep seeing these inflection points on about 5 or 6 day intervals. And so we have a very high degree of confidence from empirical information, despite all the Chinese screwing around, that in fact that's where it stands, somewhere 5, 6 days. Okay. So if we want to suppress R naught below 1.0, and it starts at 3, and that's a fairly decent estimate, we know what that number is. In order to achieve that, in order to shut off community transmission of the disease, you must have the remainder of the inverse of the R naught of people who are immune. Now, you can become immune 2 ways. One is you can get the virus and have antibodies, and hopefully that immunity holds. The other way you can obtain it is through a vaccine, which builds the antibodies without getting the virus. Okay? So, but the only way that you become immune to a virus is through the possession of the antibodies in your system, in your body. And there's only 2 ways to obtain that. All right? So, if we take 3 and we divide 1 by 3, we get 0.33. All right? If we take the remainder of that, that's 33%. We take the remainder of that, we get 66%. Round it up a little bit to 70. That means that we will have sustained community transmission in this country of this virus until 70% of the persons in this country have antibodies. Now, there's only 2 ways to get antibodies. Think about this, folks. This is very, very important. You need to understand. Transmission will not stop and turn into an isolated event until the overall percentage of the people reaches 70%. The percentage of people that have antibodies. I don't care what you do. It doesn't make any difference what you do. Social distancing can indeed slow this down. However, extreme social distancing, like we are talking about doing now, closing all stores other than grocery stores, closing bars, closing restaurants, banning all public gatherings, doing this, essentially destroying the tourism, travel, leisure industry, all right, destroying, all right, and let's not kid ourselves. Las Vegas is, for all intents and purposes, being shut down right now. They are talking about one town in Northwest Florida, Seagrove Beach, is closing literally everything, including the beaches, which, by the way, is very low probability of transmission there because, number one, you're in the middle of the sun and viruses hate UV. Number two, there's absolutely no reason for you to be kissing people on the beach unless it's your boyfriend, in which case you've already swapped whatever you're going to swap. So that's not exactly the kind of place that's all that likely for you to be transmitting a virus. And if it manages to get on a surface on the sand or whatever have you, the sun is probably going to kill it within minutes because high levels of UV will inactivate viruses. And this, by the way, is likely one of the reasons that you see transmission rates go down substantially. Now, the exception is fecal-oral transmission, which I've talked about a lot in these podcasts, but we're going to leave that alone for right now because that really doesn't come into play here. Nonetheless, Seagrove is shutting everything down, all right, including all the restaurants and bars, everything else, all done as of today. And there was a vote yesterday at Fort Walton talking about, and I'm assuming the same thing, but the results were not released. I'm not sure how that's legal under Florida's sunshine laws, but they're going to make some kind of an announcement today. My guess is they're going to let the St. Patty's stuff go on, and they're going to try to close the county. We'll see how that works out. Considering it's spring break, you're going to ruin a huge percentage of the businesses here. All right. Now, let's talk about why that's a pointless thing to do, and it's stupid. Because what we keep hearing is this is what you must do. The president's up there. We got these people in white lab coats. Oh, they know everything, right? They know everything. All right. What we are talking about here, and what they're all talking about, is trying to avoid overloading the medical system. And the argument is that if you can do that, you're going to save a lot of lives. And if you don't do that, you're going to kill a lot of people. All right. This is a false god, folks. It is a false god. And it's a dangerously false god because we're sacrificing our economy for this. I know, nobody wants to hear this. All right. Look, we don't have politicians that will stand up on a podium and tell you the truth. And maybe this doesn't apply in places like China where we can be an authoritarian jackass and run around with literal steel beams and weld them across people's doors so they can't get out. You can't do that here in the United States. You tried bad things would happen. But even more so, we're going to talk about what's going to happen economically if this continues, all right? Because the reality of it is that whether you like it or not, these shutdowns are not going to work. And I wish I could tell you they would, but they won't, all right? Because here's again, the key is what I said at the very beginning of this podcast. Until the antibody rate in the general population gets to approximately 66%, you're not going to stop community transmission of this virus. You're not. Period. End of discussion. Full stop. If we suppress that transmission for some period of time, say over the summer, because the virus happens to respond like most viruses do in the summertime, okay, which is why you don't hear about a lot of flus in the summer, although they happen, all right? If that is the case, we don't know yet, but if it's the case, and actually there's some evidence that maybe it is, because we're not seeing a huge amount of transmission in India, for example, which is kind of interesting. Maybe there's something to this. There's some counterfactuals, though, in other areas that are hot and humid, and so, yeah. But remember, folks, it's absolute humidity, not relative humidity, that matters. All right, everyone talks about this relative humidity. That's bullshit. You say, well, look, it's humid in Washington State all the time. Jesus, because it's always raining. Yeah, exactly. Now take that nice humid air and put it inside and air condition it to 72 degrees and tell me what the humidity level is. It's absolute water content in the atmosphere, not relative humidity. Okay, because that's what causes the precipitation, things like this. All right, so I mean, I know that gets a little wonkish, but that's that is epidemiologically what happens. All right, so here's the problem with the premise that we have right now. All right, the only way that you're going to stop community transmission is when we get to about 66% prevalence of people in the population that have antibodies. It's the only way it's going to happen. Everyone says, well, they're testing a vaccine. They just started. Okay. All right. So let's say that they were to test the vaccine. The vaccine's successful. Okay. Now they're going to start making vaccine. Right. And then after some period, so remember, the first level of testing is, does it kill people? All right. So that's, phase 1 safety. Right. Then we're going to do phase 2, which is some kind of efficacy. And then we're going to start rolling things out. And even if we do this on a grossly escalated basis, and remember, you can't challenge supposedly vaccinated people by deliberately exposing them. That's crazily unethical. Now, you will probably get some people who are healthy, get the vaccine, and deliberately go expose themselves on their own. You can't do it as a medical professional, but I bet you get some people that do it, that, are willing to take the sword, so to speak, if it doesn't work. But you're going to have to monitor them for some period of time, a decent period of time, in the ordinary community to see how many of them get the virus. So these guys are going to keep getting tested. And by the way, that picture you're seeing on the TV where they take that little swab and, run around the inside, that is such bullshit. Folks, nasal swab samples, they basically shove that thing up into your brain, or at least that's what it feels like. Anybody that thinks that it is anything like what you saw on television, that's just another lie, by the way. It's another convenient TV lie. It's a total load of bullshit. All right. So we go ahead and we do our distancing. We do our social distancing, community isolation, yada, 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 yada. All right. Now what happens? Well, the transmission rate falls, right? This is good. All right. So how long can you maintain that? Think about it, folks. What you've just done is shut down, essentially, for all intents and purposes, our economy is what, 70%, 65, 60, 70% services. So let's see, no haircuts, no bars, no restaurants. Restaurants are takeout only. So I can't go socialize with people. I can't do anything. I non-essential, in some places, non-essential places are being told to close. I can't go to the gym. All the normal things that I would do in my daily life that contribute to the economy, essentially all of those stop. All right, so my spending level goes down because the only thing I spend money on are my utilities and my food and maybe my Netflix and my internet connection. Okay, that's about it. And the rest of the time I sit around, I play with myself and try to paint the ceiling. That sounds interesting. If I had a girlfriend or a wife, I'm sure we could come up with some other interesting things to do, but I don't have either of those. I suppose I could scratch the cat and see how many purrs I can get. And that's all fine, except here's the problem. The bar down the street that I used to go drink at, he makes no money and he closes. The other stores that I used to frequent, the other places that I used to spend my money on, much of which was discretionary, that spending all goes to zero. All right, they close. Now, they either close because they're forced closed, or they close because we all do this because we're all being scolded on social media to do it, and there's no customers. One way or another, they close. All the people who work there lose their jobs. All right? So now they all get laid off, and yet the landlord, he still has taxes, his mortgage. He's got to pay those things. So the store owner still has to pay his rent, still has to pay his utility bill. All right, power bill for the store doesn't really go down very much, whether it's got people in it or not. And oh, by the way, the restaurant that had all the perishable stuff in the place, I mean, stuff that's in the freezer is still okay, but anything that's actually perishable that's in the fridge, that's all junk. That goes in the dumpster. All right, yeah, I'm sure they'll donate some of it to a food bank, but the point is, it's a write-off for them. They don't make any money on it. So they paid for it. Now they take 100% loss on that. Plus, the Congress is talking about making all businesses pay for some amount of sick leave. Okay, oh, that's fantastic. So we close, we lay people off. We have to pay the employees anyway, even though we don't have any money coming in. Essentially, all of these businesses are going to permanently close. Probably 80% of them are never going to open again. Now, do the Dardens and stuff, well, you know what? The ones that are franchises, those franchisees are fucked too. They're going to close as well. The company stores, maybe not so much. But all the franchises and everything related, they're all done. It's all over for them. There's nothing they can do about it. They're finished. All right? And it would be nice if that was not true, but it is true. And there's absolutely nothing that those firms can do about this situation. All right. So the economic damage is going to be extraordinarily severe. In fact, anyone who thinks we're not going to cross a 5% threshold on this in GDP is out of their mind. And I think there's now a odds-on probability we cross 10. Why is it important? Because 10% is the formal economic definition of a depression. D, with a D, folks, depression. We are going to voluntarily take an economic depression. Oh, but it's all going to be over in a couple weeks. So says the president. 15 days to bend the curve and change the outcome. No, it's not. No, it's not. Because what happens as soon as you drop the restrictions? The virus comes roaring back. Transmission comes roaring back. You can't do it again, can you? Well, I suppose you could try. But wait a minute. You already destroy all businesses. The second time, if you actually order people shut a second time, it's over. All right, for everybody. It's over. All right, so let's say that we sit down and we very soberly say, well, we're going to have to accept this because we're going to save Granny and we're going to save Gramps. And we can't deal with the alternative, which is that they're going to die. All right, I wish, folks, that you were being told the truth about this, but you're not, and we don't have any leaders in this country. And the fact is, you're not going to materially bend the curve. I wish that you were going to materially bend the curve, but you're not. And here's the problem. All right, so let's just take some numbers and run them. Let's say, for the sake of argument, that a 80-year-old person who gets this virus has a 10% chance of death. It's a very bad set of odds. 10% is very high. Okay, it's crappy. I would not like those odds. And in fact, if you were going to give me a disease that had a 10% chance of death, and I knew you were at the door, I'd shoot you. I would take the risk of a murder charge because that is unacceptably high. It's high enough that I'll kill you to prevent it from happening. And this is why, this is the emotional response that is being levered right now in order to get voluntary, quote unquote, voluntary compliance with these edicts and these mandates. The problem is Granny's going to die anyway, and here's why. If you have a serious or critical case, all right, and a case that proceeds to critical in the hospital means you're going to be put on ventilation, and when you're put on a powered vent, no matter how it's done, a number of years ago, these very same white coat, cocksucking, lying pieces of crap that have been sitting up there pontificating at you, there was a study done by those people on vent outcomes. Remember, this is for people that are on vents for all reasons, and essentially none of them are because some virus was attacking their lungs. So these are actually very optimistic numbers compared to what is going on right now. The odds are that if you are put on a vent, there is a 50-50 chance you never walk out of the hospital. under ordinary circumstances, and the 1-year survival rate for all persons put on a vent is 30%. These are not my numbers. These are numbers that came out of the very same white-robed bastards that are standing up there telling you we have to destroy the economy today. And they are under circumstances where there is no virus that is attacking your lungs. What is the actual save rate of people that go on vents in the hospital today with coronavirus? Do you notice that nobody is giving you that number? It didn't come out of China. It didn't come out of South Korea. And it isn't coming out of the United States. It isn't coming out of Italy. It isn't coming out of anywhere. Nobody is citing these numbers. Nobody. The fact of the matter is that if you don't need that sort of intervention, if you don't need forced oxygen transfer and augmentation, there is very little that can be done for a viral patient in a hospital that can't be done at home. In other words, there is really no benefit in terms of what actually can be done for you until you get to the point that you need that kind of serious medical intervention. And if you need that sort of serious medical intervention for this virus, the odds are obviously, or they'd be trumpeting them, folks, worse than they are as was disclosed in that study. In other words, it's less than 1 in 3. That sucks. Okay, that really sucks. So, 10% of the time, if Granny gets this virus, she's going to die. If she goes into the hospital, 10% of the time she's going to die. What are the odds if she doesn't go to the hospital because there's no hospital, because all the beds are full? Well, 90% of the time she goes to the hospital and she was going to die, she dies anyway. So, 10% of grannies who go to the hospital under normal circumstances with this virus die, and if there is no hospital, 11% of them die. Folks, this is math. And this is the same bullshit that gets run every single damned day when it comes to the medical system and its miracles. And it is the same when you talk about cancer treatments, this is the same thing that went on with Provenge and Dendreon. Who remembers this? Does anybody remember this? Does anybody remember all of this BS that has been thrown around for the last 20 effing years with regards to various medical interventions for cancer and this and that and the other thing? Oh, Dendreon is fantastic. It costs $100,000. And then when you read the fine print, by the way, it is a very effective treatment for late stage metastatic prostate cancer, which, by the way, is a terrible disease and it kills people all the time. Well, you know what the facts were? For $100,000, you got 4.1 months of additional life. 4.1 months. Did it change the outcome? No. No, it did not. In virtually every case, it did not. It cost you $100,000 to get 4 more months of time that you were breathing. And how much fun did you have while you were doing the breathing? Well, I don't know. That's the other question that nobody ever asks. This, by the way, this is not just an academic exercise for me. A few years ago, my mother was diagnosed with colon cancer. And the docs went in and chopped the tumor out that was in her colon. Fortunately, where it was did not require them to force her to wear an ostomy bag for the rest of her life. They were able to sew her colon back together, so she was still able to take a crap the same way the rest of us do. And when they all got done with that, then they wanted her to take chemo and radiation. And she called me and asked me what I thought of this. And I was at the hospital when she actually had the operation. But a few days later, I was on my way home. She calls and she asked the question, and I said, you need to consider that you are a relatively elderly woman. You're in reasonably decent health, not great, but decent health. You're getting around the house with a walker and able to do your own thing. I said, if you need to get some honest numbers about what the probabilities are of these treatments and what they're going to do in terms of, what are the odds that it actually beats the cancer? Okay, if it beats define beat the cancer. All right, I'll give you one. At your age, the odds of you surviving another 5 years are not all that great. But let's say that if you die within the next 5 years, it'll be of something else. All right. Then you have to look at what damage these treatments will do to your quality of life right now, permanently. It's time you cannot get back. Every minute you spend hooked up to a chemo line and all the side effects you get from that, every minute you spend in a tube getting a radiation therapy, and all the side effects from that, whether your hair falls out or whatever, all of the things that happen, you cannot get any of that time back. So you have to take all of that and balance that against the potential benefits, and then you have to make a decision. I can't make the decision for you, and I can't give you advice on what the right decision is, but I can tell you that this is not the way that your doctor is going to weigh this, but it's the way you should weigh it, because it's your life and it's your ass. So ultimately, she decides not to take it, not to do either. She lived almost another 2 years, and she had one bad week at the end. Up until that point, she was up and around and doing her thing and living in her own house. She would not move down here with me. She wanted to stay in her own home. She wanted to die in her own home. She did. But she didn't do all that badly for the rest of that time, folks, right up until the last week, okay? Now, think about it. If she'd taken the therapy, what if she got another 6 months, but 6 months of hell during the therapy? Was that worth it? I don't know. But look, we need to seriously think about things in this sort of a way, because here's the problem, all right? And this is why I'm going to come back to this, all right, with this bug, all right? If you have a 10% chance of dying if you get this virus because you were at high risk, and if there's no hospital bed, then it's 11%. And the reason is, if there is a hospital bed and you go in and you get a vent, 9 times out of 10 you die anyway. All right? Now, if you don't need a vent, all the other things that they could do, whether it be, drink a lot of fluids, here's some antiretrovirals or whatever, whatever other treatment modalities they have, anything that they could do by mouth or, externally, you can do in your house. All right, if supplemental oxygen off of a bleed valve or a concentrator, whatever, you can do that in your house. And by the way, there's another problem. 100,000 people, ladies and gentlemen, die every single year from hospital-acquired infections. 100,000. If we double the occupancy rate in hospitals as a result of people going in there for this kind of thing, we're going to double that. We're going to kill 100,000 people if we were to double the number of people in hospitals with COVID. All right? 100,000 of them would die not from the virus, but from hospital-acquired infections in the hospital. Now think about that. That is a huge number of people who are going to die simply because we sent them into the hospital instead of telling them, don't go. Now, think about this. This is all balance of risks and harms, right? And remember, when we get done with these quarantines and these social distancings and all this, and we open the economy back up, do you think this virus is gone? Have we achieved 60% immunity among the population? 66%. Because if we have not achieved 66% immunity among the community before we open the economy back up, the virus comes back. Those are facts. So what are we talking about here? We're talking about taking an intentional depression predicated on a lie. The lie is this: our medical system is very good at dealing with trauma, and it sucks at pretty much everything else. And furthermore, there are very severe risks that come from going into a hospital. 100,000 Americans die a year from hospital-acquired infections. If you go into the hospital, if we double the people who go into a hospital with COVID, we're going to, statistically speaking, kill 100,000 people doing that. We're going to kill them with infections that they got in the hospital. You have to save more than 100,000 people. Now, let's assume, for the sake of argument, that 500,000 aged Americans will die of this virus. Is that an unreasonable assumption? I don't know. But that's a terrible number, right? That's horrific. We should do anything we can to prevent that from happening. That's the argument that's being made by the people at the podium. If we do not tamp down the transmission rate, 500,000 Americans are going to die. Because when they need a vent bed, they're not going to get one. All right. Let's say that you accept that answer. I'm not sure that the number's that high, but I'm going to go ahead and I'm going to take it. All right, as an accepted answer. 500,000, which, by the way, is 10 times the death rate of the flu during a reasonably bad year. So there you go. All these people run around saying it's 10 times as deadly as the flu. Okay, let's say I accept that. 500,000 Americans. If we do not shut down the economy, they're going to die. How many people die if we shut down the economy? Well, you're not going to like this number. 500,000. Why? Because we're going to save 10% of those critical people with vents. 10% of the time, we're going to save them. All right, so you go in there and 10% of the cases, let's say we end up with 1 million cases, we spread it all out, 10% of the cases, 1 million cases, and 10% of them do not die that otherwise would have died because they got a vent tube shoved down their throat and pumped full of oxygen, whatever, and their body manages to fight it off, and they live. Fantastic. Oops. What do you mean, oops, Carl? Oops. We kill another 100,000 from other hospital-acquired infections. Minus 100 plus 100, 500,000 people still die. What did we do? We destroyed our economy, we added depression, and we ran up, God knows, when it was 500,000 people times 1 million each. How large of a medical bill did we, what kind of bankrupting did we do of the government and private insurance companies, everybody else? Because you know the hospitals are not going to do all this for free, right? Yeah. Folks, I wish there was better news for this, but there's not. And the thing is that if we drop the quarantines, the infection comes right back. So you can try to tamp this down that way. It's not going to work. What might work? Well, the focus needs to be not on preventing infection because we can't. And it needs to be not so much on slowing down infection because that's actually counterproductive. The longer that we stretch this thing out, the longer we stretch the pain out over. All right, and I wish that wasn't the case, but it is. The key has to be keeping people out of the effing hospital. Period. This is not about whether or not the hospital's overloaded. It's about keeping people out of the damned hospital in the first place. Because if we go there, if people go to the hospital, they are at an unacceptable rate of death. If we double that 100,000 hospital deaths to 200, it's going to dwarf any savings that we would have by treating Gramps in the hospital for this virus. So the entire focus needs to be on making that not happen. And that means we need to do two things. Number one, we need to find and use any safe prophylaxis that we can come up with. And the best one that we have right now from the evidence in South Korea and China is chloroquine or hydrochloroquine. I think that's the correct pronunciation. It's an old malarial drug. And there is plenty of evidence that actually does work to tamp down viral loads. Now, in ordinary healthy people, I'm willing to bet that if you do a risk-benefit analysis on this, the risk-benefit analysis says do not take it. Okay? I'm willing to bet that that's how the analysis plays. But for somebody who is at high risk, I bet it plays exactly the opposite way. Just like for somebody who is at high risk of heart attack, you will sometimes be prescribed a baby aspirin if the heart attack is from occlusive things or if you have a problem with the potential of occlusive strokes. Now, the reason you need to be medically evaluated before you do something like this is the same reason you have to do it before you start taking aspirin for this. If you have a hemorrhagic stroke and you are taking low-dose aspirin and you've thinned your blood out, it's probably going to kill you. And there are very specific drug interactions with these drugs that extend what's called the QT interval, which is a cardiac thing, and that's dangerous. So, folks, no, you do not go run off to Mexico or wherever, get somewhere where you don't have to have a prescription to get these drugs, and start taking them right now if you're 80 years old. You do that, you're asking to kill yourself. All right, don't do it. But we need right now to focus there. The entire focus on this needs to be on reducing the risk that a elderly person or a person at high risk, we cannot stop them from getting the virus. But what we can do is attempt to moderate the risk of serious and critical disease. That's where the focus has to go. It's the only place that works. And if we destroy the economy trying to do something else, trying to prevent them from getting it in this false god that we're going to come up with a vaccine, folks, you cannot get the coverage you need. No possible way can you get the coverage you need in order to be able to stop the transmission in time. It isn't going to work. You're talking about years. There's no other path forward. I don't have to like this. This is a shitty deal, ladies and gentlemen. It just sucks. But standing up at a podium and lying to people about it and destroying our economy, I mean, literally destroying it, shutting down the United States. Now, you want to close the border from outside infections? Hey, listen, I'm all for that. All right. Do I think that closing down the cruise lines right now is a good idea? Yeah, I do. Although, frankly, I think we'd be just as well served to essentially have the cruise lines voluntarily put something out there that says, look, if you have this infection running around your boat, you're not going to be allowed to dock. Therefore, nobody over the age of 60 gets on these boats for now. All right, unless they can prove that they have antibodies. And that leads me to my final point. If we are going to actually get a handle on this, we need two things. We need to know what the coverage ratio is in the public, and specifically, we need to know if specific people have coverage. I should be able to walk into a CVS or a Walgreens or a Walmart anywhere in the United States and buy a cheap, inexpensive, or for that matter, get free, a test that tells me whether or not I have antibodies to Wuhan flu. There is no such test, and none is being developed, and none was pushed for. And you haven't heard any of the people in our government screaming about having a test for antibodies developed. But it is the most critical thing. Because if I have antibodies to the virus, I neither can get it nor can I transmit it from my body to someone else. The only way I can transmit it is through physical contact, where I pick it up off a surface and put it on somebody else or on a surface they then touch. But I personally cannot get infected, and I can't infect another person. And that is a critical piece of information, because as time goes on, if I want to, let's say that I'm 70 years old and I want to take a cruise. If I can prove that I have antibodies, I'm personally safe on that boat. I cannot cause that boat to go under quarantine. And the cruise line ought to welcome me aboard, because I can't transmit the virus. More to the point, who are we going to have as medical providers that are going to actually provide this? And how about you and your granny? Wouldn't it be really nice if you could know that you and your children, your kids went to school, they got the virus, it was subclinical, then they recovered from it, and they never, but they have antibodies. If you have a 80-year-old person living in your house with you, wouldn't it be nice to know if you, your husband, and your children all have antibodies? And therefore, you can't give Granny the virus. We have no way today to do this, and there is no push on to do this. Why not? That is the only effective distancing mechanism that's going to work. Because once we start to develop, and folks, there's people out there, listen, as I've said, it's entirely possible that I've had this bug. My daughter might have had it too. We both got something that was very atypical flu back in January. But as far as I know, there's no way for me to know, because at this point, I'm sure if I could talk somebody into giving me a COVID test, which they won't do because I have no symptoms, but if I could talk somebody into doing it, I'm absolutely certain I'd test negative because I have no symptoms now. All right. However, there is no test for the antibodies. So I don't know if I had it. I can guess that I might have had it. That's not good enough, right? If I'm going to go into a hospital or a nursing home, or if I've got somebody aged or at risk in my house, I don't have any idea whether or not I'm immune or not. And the only way for me to know whether or not that's safe is for me to be able to discover that. And we're not spending any time, effort, or money on it Do you know why? Because there's no money in it. You know why they're putting all this money toward test. Nancy Pelosi. By the way, would that old prune just suck it up at... Never mind. One can pray. Test, huh, Nancy? No, if you really gave a shit about America, it would be test, all right. Where's the antibody test? Those ought to be free. They ought to be free for the handout. And you ought to be able to take as many of them as you want up until you get a positive result. At which point, for you, it's over. And you know what? I'm perfectly okay with having some way to document that you took it and you got a positive result. Because you know what? That's a useful piece of information. And it's one that people ought to be able to rely on. You ought to, it's kind of like people say, well, I took an HIV test and I was negative, before they sleep with you, right? Well, how do you know that they actually took an HIV test and it was negative? I mean, you're kind of taking their word for it, right? This is in the same sort of thing, except that your exposure in this case doesn't require that you have sex. No, now we're talking about, well, I'm in the same room with you. I have antibodies. I'm immune. I'm not scared. I'm not afraid of you. You're not afraid of me. If I'm a healthcare worker, I can help people who have COVID, and I'm not at risk. I'm not going to die. If they're in the hospital for something else, they're not worried about getting COVID from me. They're not going to die. But no attention there. Instead, what we're going to do is we're going to shut down the economy and we're going to do things that are going to change absolutely nothing. In fact, they have a decent probability of making it worse because 100,000 people this year die of hospital-acquired infections. And if you double the number of people going to the hospital, guess what's going to happen to that number? It's going to double. So do you really think you're going to save more than 10% of the people who end up in the hospital in critical condition on a vent if 500,000 people get this virus and end up in the hospital? You're going to save 50 and you're going to kill 100. That's negative 50. You kill 50,000 more than you save. If 1 million people end up in the hospital and you save 10%, that's 100. And you kill another 100, it's a wash. Folks, wake the hell up. I don't like this math, but these are facts, and they're not my numbers. The hospital-acquired infection and death rate is from the CDC, the very same CDC you're taking advice from right now. The vent death rate, 1-year mortality, is again from the very white coat lab rats that are running around with PhDs giving you advice right now. There is exactly one way to cut the death rate down from this virus, because if you distance, when you stop, it's going to start transmitting again, and it's going to happen until the antibody prevalence rate in society reaches 66%. That is a fact. The only way to tamp down the death rate from this disease, you can spread it out if you want to, which is what we're going to try to do, at the risk of destroying our economy permanently, tipping pension funds and others into absolute abject insolvency. All right, yeah, we can do that, but we're not going to change the number of people that die. The only way to change the number of people that die is to attempt to employ prophylaxis against high-risk people. It may or may not work, but it's the only shot we got, and it's the right place to focus. That and the development of an antibody test. We need those two things, and we need them now. The rest of this is bullshit, folks. I'm sorry. It just is. Look, what the government does, the government does. And unless you're willing to pick up a rifle and do something about it, you're going to have to put up with whatever orders they issue. But they're not going to stop your grandmother from dying. The path forward that I have put out on the table will. Maybe. What they're doing won't. Period. And it might actually kill more people than it helps. I'm your ticket guy. And that's the math.